Okay, today we're going to talk about the subcutaneous injections, but first we're going to talk about how to draw the injection and things that you'll need. So first, the things that you'll need is, of course, the medicine, an alcohol pad or swipe, which normally comes with the medicine, and an insulin syringe. So when we draw the medicine, the first thing we want to do is just keep everything sterile and clean. So the first thing we're going to do is take the bottle, in this little rubber top right here, we're going to clean it, because that can potentially have bacteria on it. So we want to make sure that it's sterile. So we're going to open up the alcohol swab and just go to the top of the bottle and then clean it. Now, if you happen to touch the top of the bottle again, just clean it again. But we don't want to touch it because there are bacteria in our hands. So we want to make sure with an alcohol swab that it stays sterile. Now, second is the syringe. This is what an insulin syringe looks like. And if you look closely here, you can see then the different annotations on the syringe to document the amounts that we're going to draw. Your instructions will come with the bottle, and if you have questions, please text, call, or email. But the instructions on how much to draw will be on your bottle that comes from the pharmacy. Now, the next thing we're going to do is on the back of the needle here, we're just going to pull this orange cap off, and this is called the plunger. And then the needle is in the opposite side. So the first thing I'm going to do is just draw back the syringe to about the 0.8 level, or the 8 on the syringe, and then I'm going to remove the cap. Now be very careful not to touch the needle. If we touch the needle, just get rid of it and discard it and get a new one, because it's now contaminated. So we don't want to touch the needle or the rubber stopper. Now what I'm going to do is I'm going to flip the bottle over, I'm going to rest the syringe on my hand, and then just lightly push the needle into the bottle. And then the first thing I'm going to do is push air into the bottle, and then begin to lightly pull back, and the syringe will begin to fill with fluid. So we're going to push air in and then pull back, and we'll slowly get fluid in up until we're at the level that is required for your injection. So I'm going to be at 0.1. So right here we're at 0.1. I'm going to remove the syringe and then put the cap back on it temporarily, because I'm going to use this for our second video, which is then how to inject. So that's how we safely draw the injection. The next video that I send will be then how to do the injection.